Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. I hope everyone's having a great day.
Good morning.
Good morning, Freddie. Good morning. Good morning, Colleen.
Good morning.
We got a whole group of people here today. We've got Freddie from amp2.tv making sure that all of the emails come to Dr. Pannozzo. We got our producer, Colleen, sitting there, helping us with all the calls. We got Linda on the computer, and we got Dr. Anthony Pannozzo. How you doing, my friend?
I'm doing good, thank you.
Doc, something's very funny that I don't think we ever really get into when we talk. Tell us your education. I mean, I want people to know your credentials.
Well, I went to grade school.
Okay, good. That's always a good start.
It's a good start.
Okay.
High school, graduated 16 years old, went to college. Mm-hmm. In 3 years, I could have gone to medical school, but I didn't want to because I wasn't mature enough. So I stayed around, took courses for another year. And I went to Ohio State School of Medicine and graduated there in 1963. And I was not an exceptional student, but I was a student.
Okay.
And I was quite young, I was graduating there at 23 years old with an MD.
Wow, you never told me that.
Yeah. So then I went to Philadelphia General Hospital for an internship for 1 year. They tore the place down, by the way. It was too corrupt, I guess. I mean, if you go to their dining room, they give you steaks, as many as you wanted.
Very nice.
You can't exist that way. Anyway, they tore the thing down. So then I went back to Ohio State, and the great Ernie Johnson let me train there for the next 3 years. And then I got board certified for PM&R and electromyography. And that was 67, 8. Mm-hmm. And so then I went into practice. I was just turned 29 years old, and I took a job in Phoenix on the staff there, and I was not comfortable, so I quit, and they couldn't wait to get rid of me. So,
don't say that. Well, I guess it's the truth.
Yeah, if I wasn't happy, they were unhappy.
Right.
So then I went back to Ohio, and I worked there for 35 years. So I retired at 65. And then we moved to Phoenix for a year, 2 years, and I could not take retirement. It was just impossible. All I was doing is taking care of my plants.
Can't keep your mind going just taking care of your plants.
No, you can't do that. No. So I had an opportunity to move to Florida because I knew people at the country club. And they said, well, you have a great opportunity here. We got a lot of golfers who need you. So I moved down here in 2006, and I've been working ever since.
Wow. So how come you? This is going to be an off-the-cuff question. I never asked this before, but why did you go into orthopedics? I'm just curious.
I didn't like surgery, and I didn't think they had the answer anyway.
Really?
No.
Really? Well, you've proven that over the years.
I knew that the surgery is a failure of treatment, and that's what they were offering. And so I was interested in why a pain occurred.
Cause and effect.
And this is the only thing I've ever done since I was 29 years old. And I got old with the pain.
So were you doing your practice, you were doing what you do now back then?
Yeah.
Wow.
Not
That's a good
exactly,
shot.
because every few years I revised everything as I learned more and more and more, because what I do is not taught. You can't go to any school and get this kind of information. This is true stuff right out of the anatomy book. It's I call it the physiology of pain production. Can you follow that? Physiology of pain production. So why you're having a pain, it's because you're misusing your anatomy. So that's what that means. So that gives you into the physics problem, weight bearing. So it's all a thinking process with me. And in order to find out where your pain is from, we have experience on treating a lot of people, like 75,000 people we've treated. That's me and my son. I treated 50,000 myself. So you have to know the anatomy, and we know the anatomy very, very well. And what makes it work is the design and function. So it's another way to look at it. It's a physics problem, actually, weight bearing. So then you break down the body and in weight bearing, what causes actually a pain. A pain is all from ligament, not muscle. So people who tell you that you have muscle problems because you have a pain is not true. It's ligament after 3 days. Where is that ligament? Well, you have to know the construction again, design and function. And it's not by accident that we can do flips, and we can run, and we can slide into the base, and we can do all kinds of things. We can lift 400 pounds. It's design. It's the way it's made. So you have to know what went wrong with it to make it painful. So it's a shoulder, knee, hip, lower back. Lower back is quite interesting, but they're all interesting, because if you go back to the anatomy on all of these structures, then you can find out what you have to treat. And if you don't do that, what are you going to treat?
Right.
An MRI? An MRI is useless.
Explain that to me, because everyone says MRI.
Well, because it's how you are in a point of time.
Oh, okay. So when you're going for that, that's
primarily,
okay.
That's it, and it's done laying down, which I just explained to you. The physics of weight bearing requires you to be standing up.
Right.
That's how you.
Now, Doc, is it always pain? What about tightness, or you ever heard somebody says, I can't pitch today because it feels tight, or a hamstring pull? What's a hamstring pull?
Well, hamstrings don't really cause you any problem. It's a referred pain from above that. Now, you could have a muscle pull out of the bone, but you're going to be black and blue because that's blood. And unless you have that, you have no hamstring stuff.
So a player,
it's a referred pain from the lower back.
So if a player, let's say he's running from first to second, like what happened to David Wright over the weekend, he pulled a hammy. Now they took him out of the game because last year he pulled a hammy. He ended up missing 6 weeks. This year they took him out right when it happened. They put a cortisone shot in, which I don't understand.
Where'd they put it?
I don't know. It wasn't there, Doc. That's what I'm trying to find out. But they put a cortisone shot in. They iced it up immediately, and they did an MRI on the leg. So my question is, hamstring, that's the thigh, correct?
Right.
He's holding the back of his thigh like the muscle gets into a giant ball. You ever have a hamstring pull?
Oh, yeah.
I had a hamstring pull. Is it in the muscle? Is it in the lower back?
A real hamstring pull would be the muscle bone connector. There's an inflammation there. You can hardly get that. I mean, that muscle is huge, and it runs from the lower back all the way down, the sacrum, all the way down to the knee. That's what the hamstring does. It flexes your knee. And the ischial tuberosity has part of it also. So you got ischial tuberosity, then you have the muscles start in the bone and go down to as a tendon to the knee and makes it flex or bend. But the referral area is in the lower back.
Really?
Yeah, there's 2 areas there, and one goes down straight down the back, one goes down the side. So that's I just given you everything right now.
Well, that's good because David Wright has a lower back issue.
Right.
That's a true story.
Well,
he didn't even know that.
While we're on that subject, we do a lot of research
Good,
here. So all this stuff that people ask me, I'm going to answer that question. All my friends out there that are listening, and all you other people that want to know what's going on. As Freddie, you take this thing. You looked up all of the things that are not allowed to be taken by athletes
At the major league level, correct.
at the major league level, and what Dr. Pannozzo gives, which is Decadron and Maricane. They say it right?
Who knows what that is?
It's just a painkiller.
Okay, and that's
It is
not even on the list.
It is not on the list.
Not on the list, right?
So if anybody out there is suffering from pain and their livelihood is determined by that, let me just give you a
Now,
number.
there is a reason why this works and the
Okay.
other ones don't.
Okay,
Yes,
good.
That's why
true.
they're on the list.
Good answer.
Because most of them work on the brain. And they do nothing for the problem, which is inflammation of a part. And so that's why what we do works, because we put it right where the inflammation is. And it takes that inflammation right out, and the pain, by the way. So there's a reason why these things work, and that is because they're misplaced. The diagnosis, location is most important.
And how
You've
come you
gotta
could
have it.
How come you could find it?
Well, because I explained to you how my career was. We went back to the anatomy, the cause and effect, weight bearing, the physics problem.
Okay.
All of this is on the physics basis. Weight bearing. What structure holds these things? For instance, you could have a knee pain in the front because you're walking around with a bent knee. The weight of your body, you could be a 250-pound guy, and your whole weight will be on that patella,
Wow.
the kneecap.
Wow.
Are you made to do that? I would say no. That's why it's painful. So,
Well, I can understand how he can do it, because as a coach, I could tell you right away by looking at a player how he's going to hit by his body. You're doing the same thing. You're sizing up the body, how they walk, where the pain is, and
Right.
everything else.
and a good coach will find a good doctor who understands this stuff and will help him keep that player on that field. That's where the money is. It's not sitting on a bench getting some strange surgeries that takes a year to get better. That is not going to do it. You want this stuff treated right away. And you want the coach, a good coach will have a good doctor behind him, not his friend who's the chiropractor or the trainer, but a good physician who understands cause and effect, pain-producing structure, and is able to treat it. And we do all that. So it comes second nature to me because that's the way I train myself.
So, wait a minute. I got another question.
Well, I just want to give out the number. 800-889-0267. 800-889-0267. If you've got a question, do you want to ask Dr. Pannozzo?
Or share a story.
Yeah.
Or share, and this is free. Just ask me. You don't want to give your name, you don't. He'll be more than happy to answer your question.
The calls are not screened, so
We don't
whatever you want
screen
to
anything.
say.
There's nothing on the show screen.
Nothing.
Wait,
We say
Doc,
whatever we want.
I have to ask
What's
this
that button,
because
Colleen?
all of a sudden, the light is just flashing in my head. So I get a baseball player. He's going to be out 2 weeks. Now, I need this kid in the lineup. When he when he hamstring injury, because I don't know what the extent of it is, there's blood in it and inflammation in the muscle that's preventing him from being able to
Yeah,
run.
if it's a true hamstring.
If it's a true hamstring.
And
Or lower back.
it'll be lower back, I'm pretty sure.
So if we have David right here and you do what you do, David, 2 days maybe,
No, one.
is back in the lineup.
One day.
Back in the lineup.
Holy mackerel.
Well, when you got taken care of by Dr. Pannozzo, how long was it
Yeah,
before
but
you
I'm
could
not a
pick up?
professional athlete.
Yeah, that's exactly right.
I mean, David Wright is muscle. His muscle is a muscle-bound guy, and he uses those muscles intently. So my fear
Well, you
is...
see, but it's never muscle, though, or hardly
I
ever.
agree. I know that now.
And remember, you're not a trained athlete,
Right.
although you felt good. And you
feel
were
fine.
dancing in the street
That's
because you
right.
felt so good.
I know.
Well, a trained athlete can recover quicker because the part that was injured is treatable, and then it just slides into the rest of the body. So they're out there doing everything. I know people that play 18 holes of golf the day after one shot because they couldn't play before. These are true stories. I mean,
Well, I was there when the
I
golf
don't
was
have
there.
to make anything up. These
But
are
a
all
hamstring pull
Yeah.
means 2 to 6 weeks inactivity.
That's baloney. You have to think what
Right.
you have to think like an activist. Why sit there and watch the guy deteriorate right in front of your eyes? Go get it if
Well,
you know
they're
how.
giving him
The
treatment.
trouble is they don't know how.
I understand that. They're giving him treatment,
What treatment?
like hot, cold.
Oh,
they do a
forget
lot of
it.
that.
Yeah, that's-
Cortisone probably.
Most of the time, the hot and cold doesn't even go where the problem is. Because a lot of these pains are referred from other areas.
That's right.
And they're all small. That's big. That's all they are.
Can you imagine? I'm going to call David right today. I'm
Well-
calling the Mets today.
I mean, what we're trying to bring out, Freddie, is trying to educate the people that you have a choice. I was reading WebMD, just just to find out about back surgeries, and it's amazing that they can't even say that every back surgery that you do is going to come out well. It doesn't. And what people have to look for is all these things, anesthesia, number one. I don't care what anyone says. When you go under anesthesia, that's the first thing that you. Am I right? I mean, you're a doctor that's been in the operating rooms.
You could have a stroke.
Yeah.
It's rare, but you could.
Sometimes you can't get out of anesthesia. You're allergic to it, whatever.
Well, what Dr. Pannozzo just said, the number two thing was stroke or heart attack from anesthesia.
It happens.
Yeah.
Any surgery is a failure of treatment.
Yeah.
You're throwing up your hands and say, well, go in there and see what you can find. That's essentially what you're doing when you do that.
Mm-hmm.
A real diagnostician, and I'm not saying I'm the best. I'm close to it. I try hard. I mean, I really
You do. You're very well.
And I have a brain that can put diverse facts together, and that's what makes it successful. So if this works, you have to find out why that works. This works. Why does that work? Put them together. Do this, try it out. And that's how we went for all these years now, 52 years. Right now, we probably have a 100% cure rate on low backs, hamstrings, knees.
Migraines and scoliosis.
Oh, migraine is one day, 2 minutes. I mean, people will listen to that and say, is he kidding me? No, I'm not kidding you. This is actually true.
Go to Pannozzo.tv and you can see all the people that have been cured from migraines in one day.
That guy that wanted to talk for me on headache, never seen it.
Well, it's on.
I haven't never seen it.
Have you seen the one?
Sure, I put it
Because you
there.
live in his area, right? Okay.
Oh, the commercial on TV?
Yeah.
His name is Burke, and I'd never seen the thing.
Yeah, no, I've seen it.
Well, let
I
me tell you why you don't see it, Doc, because you're taking care of 30 and 40 patients when your TV is on.
Well, that's true.
Well, Doc, my indicator is when me and Linda go to dinner, we go to different places to eat, and people, because I have my colors on, they come over, and they go, do you belong to the Dr. Pannozzo show? I says, yeah, we do.
Well, you got MTV. Every shirt you wear has MTV. But
That's what we do.
It's very good. You
That's
get
what we
you
do.
get a bell for that one.
But I'm amazed because people out there, you have a choice. Absolutely right.
Yes, everyone has a choice.
And if you choose to be afraid to get healed, then you're just betting against yourself. I don't understand that. I'd rather walk around in pain than to come and see something different. It doesn't mean the different is bad.
No.
I won baseball games hitting a home run, and I won baseball games tapping the ball in the bun and squeezing a run home.
Right.
It's the same win.
A win is a win.
That's right. So
You
you
know-
get it done. You just get it done where other doctors don't understand it.
That brings up the economics. And insurance companies of course, don't want you to be treated. That's why they have a copay and a deductible. They don't want you being treated. They want your money, which they invest and become rich.
That's right.
I mean, the insurance companies in the last couple of months with Obamacare have huge increases in their stock price. Follow them. United Healthcare, Humana's the worst. And the rest of them. Blue Cross Blue Shield you can't follow because they don't have stock. But they're preventing you from getting treated. So if your insurance company doesn't cover like Humana Gold, they don't cover anything. They have a small amount of doctors in their plan, and that's who you're stuck with. And this is no bargain, people. This is your body. I mean, I look at myself and I say, I don't care what it costs. If it's going to make me well, I'm going to spend it on myself. My kid doesn't need it. I don't need to leave anything. Make payments, dude. You got to take care of yourself.
And you've actually taken care of people who didn't even pay you because you felt so bad with scoliosis.
Well, we do the best we can
Yeah,
for people. My
exactly.
secretary in Phoenix,
Right, you were telling me that, yeah.
talks to them and puts them on a plan. It makes it easy. But the main thing is you get the thing taken care of so that you can have a life. Otherwise, what do you got? I mean, we had a guy in there Friday. His son said he had a knee. Okay. When he got there, he said he has a low back. Well, the price changed, and he didn't have any insurance. So I said, well, just make payments. You'll be all right. We'll take that pain out today. You're not going to have that pain anymore. You know what he did? He refused. He walked out, went to the chiropractor. Now, the chiropractor's not going to have the techniques that we have. There's no way they can do it. And I have nothing against them.
No.
It's science. It's a science. So he's going to spend that much money or more on the chiropractor and maybe lose 3 months of his life, whereas we could take that pain out in one day. So this is what you have to look at, and it's a value assessment that you have to do for yourself.
Well, when you mentioned the word chiropractor, I have to go back to my old notes because I want people to understand. I want you to go to this website, ladies and gentlemen. It's EDZARERNST.com. This is a doctor who's got more degrees than I have hair on my head, and I still have a full head of hair for those. And one of the things that he said is that chiropractors have a very limited scope. Actually, he said a narrow scope of ailments. They do not know how to diagnose a patient because they are not considered to be doctors.
Well, they're not trained in diagnosis.
Right.
And remember, a physician, an MD, has to produce. If you last like I have all these years, you got to be doing something right.
That's exactly right.
Otherwise, I'd have withered on the vine, as they say.
And here's something else. It's a good thing I saved my notes. If after 3 days, if you don't see results, you're going to the wrong person.
I have that on my wall.
Yes, you do.
Yeah.
And that's not me that did it. This is a very known doctor. He's got a PhD, an MD, all these little things next to his name, and he's saying the same thing. So everything, just so everyone knows out there, everything that we say is backed up by not only Dr. Pannozzo, it was backed up by experts that say the same thing.
Well, it's an open mic. Anybody who wants to call in.
Anybody, we don't care. We don't.
You could tell people I don't know what I'm talking about.
Yeah, if you're a chiropractor, you want to use a different name. Colleen just lets it go through.
But you better know what you're talking about.
We're going to take a little break now, and then I promise everyone who's sending in all these questions to Gio and Freddie that I'm going to answer some. Is that okay, Doc?
Yeah, I want to talk about scoliosis bracing also.
You got it. We'll be back in about a minute and a half.
Okay.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you or somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon.
You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pannozzo's Sports and Medicine Hour.
We are back. Before we go to the questions, Dr. Pannozzo wanted to say something about scoliosis.
Scoliosis.
Okay.
I have this brochure on scoliosis bracing. This is by a orthotic and prosthetics guy, and does great work. Except we know what causes scoliosis. We don't have to brace it. We don't have to brace the scoliosis at night.
And what does he say?
And he's saying that's what we should do, brace them at night, and so it doesn't get worse. And I'm saying, well, the thinking has to be, how do you improve it, not how do you prevent it from getting worse? So it's a positive against a negative thought.
Agreed.
My thought has always been positive. How can I fix it? Not how can I prevent it from going bad? I mean, I can't do that.
And he sells the braces?
Oh, yeah. Sells the braces, and there's a picture of it. Now, I'm sure he's a really upfront guy, very honest and everything else. But remember, the ideas change in time, and we could take care of a scoliosis at the drop of a hat. We know where it's from. We can analyze it properly. We have the equipment to do it. And it's either an exercise, ultrasound, which is the deep heat, or a shot. And it comes right out in front of your eyes, as you've seen
I've seen
Freddie
it.
has
I've seen it.
recorded
I was
these
amazed.
things.
But Doc, you don't.
I don't call you every time because this is routine business now. You know,
No, I
you come
understand,
in
and
my
I
office
appreciate
and
when
we're
you called
straightening
me.
up-
Believe me.
We're straightening up your scoliosis as a routine basis. We don't. I mean, it's not published work, and so people say, "Well, you can't do that." My doctor says it's not true.
Yeah, every doctor
That is
has
not
to.
true. Your doctor has no business telling you anything unless he talked to me first.
If you bring him into your office, whoever this doctor is, I would love to see
We'd love that,
where
yes.
he would hide.
Me too. I mean, anybody who comes in, I'd be glad to show them everything. I mean, I have nothing to hide. It's great. Along with the migraine treatment, these are world class things.
That's right.
I should get the Nobel Prize for medicine for these things.
Yeah, you might be kidding around, but
even
you're
if I
serious.
promote myself.
No, you should. I mean, look. I was telling Dr. Pannozzo a lot of times we have breakfast and we just talk. I know somebody who can't believe that he could get rid of migraine. He went to his buddy who sent him to a doctor that gave him 10 shots of Botox.
10 shots.
10 up here. And
He must look 50 years younger.
no, well, I said, you're going to have the nicest head of everyone. I said, the only thing I see different from you is you have no more wrinkles on your forehead. But I said, 10 shots. Now, I know that that's like $1,000 for a vial. They charge $1,000. And here's what the doctor told him. It'll get rid of your pain, but you have to come back every 4 months. So I said, wait a second.
But you see, it doesn't get rid of the pain because if you know how to examine for it, you know
Right.
where that pain is, and I can do that.
They didn't even examine. They gave him the shots
No,
right
they're
away.
going to people who don't treat this kind of thing.
I know.
They're treating their pocketbooks, which is the shots. They're not treating headache.
Well, he's getting mad now. We got to find.
I'm getting mad now.
We got to find the cause. You see, here's what people, and I'm getting so mad.
Listen, calm down.
No, because you know what? The difference between us and the animal kingdom is we can make a decision. You know, the shark goes after a license plate because it looks like food. Why would anybody, I mean, I don't care who it is, why would anybody not get a second opinion? Or it doesn't cost anything. They get a second opinion.
You know, the group that approved that treatment for migraine, they got to get a life because they're not doing the job.
No, they're
I mean,
not.
they're being paid off, I think. I mean, how could you approve Botox for headache? Headache is a symptom. Unless you treat the cause, it will not go away. Will not. You know, these kids have it too. You know?
Oh, that's a terrible thing when the kids at 15 years old are walking around with scoliosis and they're going in for surgery. I mean, why do that when you have a chance to actually talk to somebody?
The younger kids at 2 years old are getting what do they call it? They can't move their head. Those are all neck injuries. Autism. Those are all neck injuries. But there's such an industry there already established through the
Cash
teaching,
cow.
the therapists, and all that. What the hell are they treating?
It's a
Excuse
cash
me.
cow.
Well, he's right. You know why? Because if you look at a lot of these people that have children, why was one of the children have autism and the other four don't? So if you look at it logically, they had to get autism by coming out, coming out of the womb the wrong way.
But you understand that there's no genetics for that.
No,
And you
because why
can't blame the family for
No.
that.
Why the
This
other
is
five
an
get it.
injury at birth. Or it's a fall during the first couple of years when the kid starts running around, they fall a lot.
and they don't tell their parents.
And when do you notice autism anyway? It's at 2 years old or 3 years old. That's when you notice it.
Right.
And what do you notice? Well, they don't follow your eyes.
Mm-hmm.
You know, their neckers are stiff. But they're missing it because the people they're going to don't examine necks. They don't know how to do it.
Doc, if I can't get people who have a bad back or a migraine to understand what we're talking about, I'm going to lose them at the word A for autism. It's just a fact.
Well, let me put you this way. So if any of you have been told by your doctor If any of you have been told by your friend who sent you to the other doctor that you need surgery, let me tell you what you're in for. According to WebMD, now that's a pretty prestigious thing, WebMD. I mean, they write about it. They say you could be into reacting to anesthesia. Well, you can't get that with you, right? You can't.
There's no anesthesia.
Bleeding, you're not going to get bleeding from you, correct?
Nope.
Infection, what's the chance of getting how many people? Okay. Stroke or a heart attack? Okay, no. Recurrent disc and herniation.
Nope.
Can't get that, huh? Okay. So now let me ask you a question. Tony's on the phone. He wants to ask if you. Oh, let me put you on Tony. Let him ask himself. Hi, Tony.
Tony, you there?
Hi, Tony.
I-
Tony, we
Yeah,
hear you.
you're on
Come
the air.
Yeah, I was wondering. I wanted to ask him if, is there any possibility, sometime like a hip joint where you have supposedly bone on bone, is there any possibility of injecting the joint directly?
No, we do not inject the joint directly. We inject the ligament around the joint. That's where the pain is. You cannot have bone on bone.
Okay.
It's a euphemism. It's they just interpret that. But ask yourself, if there's a cartilage in there, where it happens to the cartilage?
Well,
Nothing. It just gets compressed. It's always there. So yeah, those are treatable.
yeah, but that's what I want to know. You can inject that.
Yeah, we
ligament
take the
there.
pain out, not inside the joint though.
Okay, because I just was wondering.
It's a good thought.
Thanks, Tony.
Thank you. Have a good one.
You too,
Okay.
my friend. So if anyone wants to call Dr. Pannozzo like Tony did, you could call him at 800-889-0267. Or, let me put the or in, after 12:30, you can call him directly at 561-381-5800.
What about the 844 number?
Forget that number.
Oh, forget that
This
one.
goes to
Because
both
you want the number that they don't have to pay for.
Well, they're on two stations, so tell them about the two stations. Les.
We're on WBZT and ZZR. We're on an AM station and an FM station, so if anyone wants to call, you could use this one number that'll get you to our wonderful Colleen.
And the two websites.
And it's 800-889-0267. Or you could go to Pannozzo.tv. And Freddie, the other one?
Pain centers, national pain centers,
Nationwide.
nationwide.
Okay. And you
Or
can
just go to my name on Google.
or
You
go to
can find all
Dr.
that stuff.
Pannozzo on Google. So let me spell that name. Pannozzo. Now, you want to take some questions, Doc?
Oh, hold on.
Okay.
Doc, I am on your website right now. And when you go to the front page on Pannozzo.tv, Dr. Pannozzo commercial migraine headaches, Dr. Pannozzo scoliosis patient from England. The two commercials are right there.
Excellent.
Just click on them.
Click on and
Click
find
on
out.
'em.
You know what I always say?
You know,
Picture's worth 1,000 words. Am I
Well,
correct?
it's an educational show. That's what
Yeah.
I'm doing here.
That's why we do it.
I don't get paid for this. I'm just educating.
Neither do we. So we believe in you.
And I hope somebody gets something out of it. It's it's a shame. You never want to give up the expertise you develop over the years.
Mm-hmm.
I mean, no matter what field you're in. Don't leave the earth, with all the secrets in your head. Try to expand on it and go outside yourself a little bit. After all, we're all human beings. People went out of their way for me when I was growing up and let me do things that ordinarily we would not do. And that's what this show is about. This is education. Get the best you can out of it. Everything we say is true. You can all go to the anatomy books. Everything is in there.
And we want people that do not agree with Dr. Pannozzo to please call us.
We're looking for Stump the Doctor.
In other words, you don't even have to tell Colleen that you're a doctor. You don't have to tell Colleen you're a chiropractor. Just get on the phone, give us your name. You could even disguise your name. We have an open forum here. We don't screen anything.
We will find out who you are, though.
And we'll come to your house. And we will really take care of you.
No, but the doctor, if the doctor runs into something that he hasn't handled all these years, which I don't think is going to happen, then it's a good thing because we learn.
Well, look, I have to get to these calls because people need to get mad.
Go ahead.
Okay. One question you already answered that. Alex wants to know what kind of, if you're the only one that does it. We answered that. So let's go to a new website. It's called sportshouting.com. And Sanchez writes to Gio, I am a soccer player here in Florida. just over from Spain. I've been on the sideline now for 2 months with an inflamed knee. They drained it, and it still hurts. I can't put weight on it, and how the club may want me to have surgery. What do you say to Sanchez?
I would say there's nothing to operate on the knee.
Okay.
The construction of it is such that it's all treatable. The main problem with the knee is a periphery. Mm-hmm. There's a ligament that holds the femur and the tibia and fibula together.
Okay.
Now, when you misuse that knee, it's going to be painful on the ligament outside the knee, not inside. There is no pain fibers in the knee. If you want to check it out, go to the anatomy book.
Right.
It's right there. So when they talk about replacing your cartilage in your knee, I mean, the whole thing is baloney. Yeah. All you have is a ligament, a bone-to-bone connector, which is pulled. So it's a sprain. Mm-hmm. Outside the knee, not inside. So all of this is treatable. All the fluid is because the knee doesn't feel normal. So it produces fluid as a cushion. But that gets reabsorbed, so we never take it out.
One of the things Sanchez says is they say his ligaments were damaged. He was told.
Baloney. Their ligaments were sprained, but they're all treatable. And but you have to understand that the hip places the knee. So if it isn't a direct hit on the knee, it could be a referred pain because mm-hmm. of how you use the knee. So any pain is a misuse of normal anatomy is actually what it is. And so you have to find out all the way around, how is it designed? Is it all there? Is the pressure on the knee too much because of the hip? Mm-hmm. Most people don't even examine the hip. They're treating the knee, and the hips are causing it.
Well, that's a good point, Doc. They may be working on their own part of the body.
That's exactly right. So you have to understand the cause and effect relationships of all these structures. They all work together. The design is magnificent if you understand it.
In soccer, you ever heard of a dig, right? Guy has the ball, a guy comes across and digs into him, and the guy goes down, he's holding his knee. But that doesn't mean that the injury didn't occur on his hip or lower back.
Well, if they're falling, you have to work it out. You have to examine for it anyway.
Right.
And then these injuries you're talking about are injectable. They're right in the surface. They're right under the skin. They're not inside the knee.
Wow, that's amazing.
And when you take a trainer who doesn't understand this,
he's looking at the knee
because he goes to the orthopedic surgery. He follows what they tell him. All right, you can be sure that you're going to sit on that bench, you're going to do the wrong exercise, and you're not going to get treated right. Now, when you walk into my office, I'll treat that thing the same day you got hurt. I mean, it's my obligation to do that.
Mm-hmm. Wow, that just opens up a whole new window. Can you imagine? You're looking at the knee, and the pain starts at the hip. I mean, the knee may be receiving the pain.
Yeah.
But
well, let's look at a natural case from someone who everyone knows. The Love Doctors and Leah. Leah was diagnosed with ankle pain, and she said she was going to her podiatrist. And I said to her, like I say to everyone, if you want to endorse Dr. Pannozzo, you have to have a pain or to come in that he could look at, and so he could talk from the heart. She was going to get a boot put on and get shots in her ankle. Uh-huh. Doc, tell us exactly. I was there. That's how I could verify what you did when you saw Leah. Well, how was your diagnosis?
I watched her walk in from the waiting room, and I said, "There's nothing wrong with that ankle."
How did you say? How were you able to do that?
Oh, because I know how it's supposed to act.
The mechanism of the body. Okay.
Yeah. So we examined her, took a film. We do a special film, by the way. Mm-hmm. One might say, "Well, you don't use we don't use a special X-ray from the radiologist. We use an X-ray that we do in the office. It's a weight-bearing film, an engineering study, actually.
Wow.
And so we know where the problem is already by history and examination. Then we take the film and look at it. And her problem was L4-5 was an annulus pain, and I gave her 2 shots there. That's the last of it. We never heard from it again.
Why did they want to put a boot?
They don't know about it.
But what was the idea behind it?
A podiatrist, I guess.
They don't know how to examine things. They're surgeons primarily. Mm-hmm. Okay, and if you have an ankle pain, they're going to put a boot on you and give you a shot, no matter what it shows.
Because
But that's what
Jeez.
they do, and I don't know anybody. I don't know any of them, but I hear from people coming in to talk to me, and you can't do things like that. You have to know what the heck you're treating. You have to be able to put your finger on it.
Well, there's also something else, Doc. I don't know if you know this, Ray, but podiatrists could only X-ray and work from the toe to under the knee.
Really?
Yep. They can't diagnose anything else by law.
Yeah.
Anything by the knee, plus it's an orthopedic guy.
So what she had was a pain pattern that you have to know about and be able to examine for it. And we do this a couple of times a week. I mean,
And you
people come
found
in-
it.
Yeah.
Yeah.
You see, that's the difference. That's why a lot of people can't understand this conversation, because you can find something that's right in front of them and they don't understand it.
No, I had the same thing.
Well, they have no reason to understand it. They don't. They're not diagnosticians like me. A podiatrist is going to work on the foot.
Yeah,
that's what he does.
That's all he could
But
do.
they're putting a boot, Doc.
Yeah.
They're not helping the matter. They're putting a flat tire on a car.
Well, but that's what they're
right.
trained to do. And orthopedic surgeon will send you to a PT, a physical therapist, and you can't work those people because they don't take orders.
I see.
So that's why we developed a lot of the things that we do, because there's no other way to treat people. If you want to get treated the proper way, very fast, very efficiently, without any effects down the road, we do that.
Now, you had said that the orthopedic sends them out to certain people. Information comes back, and he reads the information that he's getting from other people, right?
He doesn't do it himself.
He does it himself. Okay, so I got a new line of action. I'm not gonna compete with the orthopedics no more. You guys are God. Love you, love you, love you.
Right.
Send him down to Dr. Pannozzo and
Right.
get a level, an understanding of what he would do. Send it back.
Right.
See what happens.
Yeah, they do a terrific job on what they are trained to do.
Yeah.
It's not taking away anything
Correct.
from anybody.
No.
It's just a new approach that we're trying to get established, which is not taught to the podiatrist, the orthopedic surgeon, the rheumatologist, the physical therapist, the chiropractor. They're not taught these things we're talking about.
Unbelievable.
Yeah, it's unbelievable, but true, also true.
It's funny. The United States government should hire Dr. Pannozzo. Do you know, with the money that they're bleeding and medical procedure and everything else? I mean, I'm not talking about changing the medical industry because that's ridiculous.
Right.
I've
just
written
a
to
different
Medicare
twist.
about this.
Yeah.
All right, so do not pay for fusions, where they put the screws in your bones. I said, that's a loss because there's inflammation under that, and they're
Makes it
coming in
worse.
to me for treatment.
Yeah.
And don't pay for that, and they're still paying for it.
Well, Doc, it's amazing. You read my mind. Spinal fusion, according to WebMD, the most common back surgery. The surgery no matter what they do, it restricts the motion between the bones and the spine. Fusion also limits the stretching of nerves. So, what does that mean, Doc? They're not fully mobile anymore after that surgery.
Well, the part of the problem is they're being fused crooked.
Right.
Whoa, wait a minute. What are we fusing here?
Spinal
Spine.
fusion.
The spine.
Your spinal cord is going to be fused.
Not the cord.
No.
I mean,
The
spinal
bones.
column.
The bones.
How do you bend over to tie your shoes?
It's the back of the hips that move the most.
So it's still going to move a little bit.
So
Yeah, it restricts the motion between, what Dr. Pannozzo said, the bone and the spine. That surgery. So
But
if
under the screws is where the inflammation is. And
Under
now,
the screws.
Now I have to devise a method to getting under that
To get to the inflammation.
to get relief, and I do that. But I always shake my head. What in the world were they thinking when they did all this?
When you did the weightlifter, my friend, that he had all those screws in place because his foot was demolished in a motorcycle accident. You showed me the x-rays of his foot. And you said the inflammation is around all that metal. And you
Yeah.
found a way to go around it. It took you a little bit, but you found a way.
I think they did not go past the joint.
Correct.
With that. That's why we were able to treat it successfully like that. Had they gone past the joint with the screw, in other words, two bones screwed together, we would have had a harder time doing it. So that's the ins and outs. I don't want to say too
Well,
much.
I remember that was the first
Wait,
time I saw him work this.
I think this came from Arizona. You ready for this one? Singe from VK.com writes in, did your son, who you had on the show the other day, did he go to school to learn his trade, or was he something you taught him?
Both.
Okay.
Both. He learned what they ever had to teach him, but we just honed him up so that we got the results faster without therapy. See, we don't do any therapy in my office.
Or drugs.
Or drugs. And so in order to do that and get the result, you have to know what you're doing. Now, for instance, you're not allowed to leave the office with the same pain you walked in with. Now, that sounds trite and it sounds comical, but it's not. It isn't. It's true. If you are not happy with the result you got, then I'm going to have you sit there for a couple more minutes, and then if you're still not happy, you still have that pain, we're going to go right back into the procedure room and do it again or do something.
Well, I got a call before anyone I just got one in from Mary from Pinterest, who ready for this one, Doc? I've heard and seen your commercial on migraines. I've taken Botox, and the pain stopped, but it came back. Woo! I was told I have to come back for another shot. Does your procedure have the same outcome where I have to come back to get another shot? I know the answer. Freddie knows the answer. I'd like to hear it from you.
No, it's a cure.
Okay.
That's the amazing thing.
One shot cures it. Here's the ins and outs of that, though. There's two sides. One side could cause the other side. So if we do the cause, but the effect is still there, then you might still have it. So you need a second shot on the other side. But one shot does it, usually. And
but four Botox shots or 8 or whatever,
10.
you come back, that's going to be 10 times more
but
expensive.
look at what
than
it
you
costs,
do.
and not only in money. That's the least.
Time.
It's about $1,500 a vial.
The time and the suffering you have to do, and to carry that weight on your brain all the time that you have migraines. Oh, migraines. Gee.
So you would say a 99.9%.
Once we figured out where migraine's from and why it's from there, it's easy to treat.
Cause and effect. You find out where it's coming from and you treat it.
Cause and effect.
Okay.
Right.
So I could say on this radio station that you cure about, what was it, like 99 to 100% or 100% totally?
I mean, it's pretty good.
Yeah.
99.
I've seen 4 people. No one knows who I am, but if you go to the website, you could see the 4 people that actually did get cured. And not only one of them, he cured of TMJ.
Yep.
That's amazing.
People don't know Les, but he he hangs around the office and talks.
I talk to the people.
talks to the patients.
I got no life, and I love this.
And he gets it firsthand from them. And Freddie does too when he's in there recording. So these guys are involved, and they could be involved daily. They have other things to do, but what you're hearing is stories that they hear.
I saw a man. I've been with you now for about a year, talking to you and understanding.
A year, yeah, April.
And I saw this gentleman who had a cane, and he told me when he saw Dr. Pannozzo, he was wheeled in on a wheelchair, and he had a named because his wife just couldn't lift him in and out of the car. He's got a cane, so he's walking. He said 99% better. And he said by the time I get done, I'll be able to walk and do some exercise. I mean, that's something that kind of makes you cry. It really does when you see somebody like that who's suffered all his life. I mean, that's a beautiful thing to see someone cured like that.
Yeah, I saw a lady who was crying because he did the same thing for her husband. She was the one that was suffering.
Yeah.
Because she couldn't lift him anymore.
No.
He couldn't do things anymore. Now he's with a cane. He said to me, this man changed my life. And they go into dinners, they go to movies,
Sure,
they do things they didn't do before.
So all you insurance companies that are listening, he doesn't have an aid anymore. What is that saving you a year?
I didn't think about it.
Actually, the insurance company should be driving everybody to my office.
I mean, come on.
We save them money.
Yeah.
I mean, look, there's no MRIs at whatever they charge for. No surgeries are being done. What does a knee cost you to be operated? $40,000.
What? Oh, I'm sorry. You're going to between $65,000 and $80,000
for a knee.
For a knee,
if they get it right.
If they get it right.
And we're charging under $500 for that.
Well, you still have to pay for the operating room. You still have to pay for the
Doc,
anesthesiologist.
charge $65,000, will you?
$65,000.
Charge $65,000. Let them come in and pay $65,000 to get looked at.
You know what? The mentality of people. Well, if he's only charging this amount of money, it
doesn't work.
Yeah,
Well,
right. Exactly.
It can't work.
But then your question should be, why do insurance companies do that?
I don't know. I don't know that answer.
Because on their committees, they have orthopedic surgeons, physical therapists, and social workers. Those are the ones who are advising them on what to pay for.
Well, you got
So
500
you come
people
along,
seeing them.
Pannozzo, the little guy from Delray Beach, and they say, what does he know? You know, I got this expert here. He knows. But he's a surgeon. They're involved in it. I'm not involved in the hospital or anybody like that.
But this is when I'm changing my angle now, Doc.
Yeah.
I'm going to let the orthopedic be the king. He
can
is
be the king. Let
He's
him do
the
what he
king.
wants to
be
do.
the king. Yes,
Let him be
let
the king.
We're not
Send
saying-
us for an opinion.
So, to me, okay, maybe it's because I question everything. I do. I just question everything. And when I first met him, I sat outside waiting for the people to leave so I could talk to him. And you sit in that office, and it's like you just came to the Messiah. Moses opened up the water so they could come to see Dr. Pannozzo. I got a bill for that, right, Colleen?
You know, I just love this guy because he sent me in to see you first.
And then we went. I said
sent
you went
me
to
in
get
first.
cured, and then look,
By the way, you grew again.
Yeah.
Have I?
Yeah. When I first met you, you were shorter than me. And I was looking down into your eyes. Now I'm looking up into
Maybe
your
you're
eyes.
shrinking.
I'm not shrinking. No.
I work out every day. I know it doesn't show, but I do work out every day. My wife thinks it's because I like to talk to the ladies, and I keep telling them. I went into him one day on a Monday because I had just come back from vacation, and he looked at me and said, "What's going on?" I said, "I can't walk. I have a pain in my leg. I have a pain in my groin." He said, "Come here." I said, "Okay." Gave me one shot, and Doc, this is real. This stuff really does work. Next day I came in and I said, I'm still having the problem in the groin. He said, hold on. He pressed where the pain was. I jumped 6 feet. The needle never hurt. That was almost, how much, 6 months ago? Maybe 5-6 months ago? I have not had any pain. Now, I couldn't play golf because I couldn't pick up the ball. So I'm telling everybody, you know what? I would bet my last dollar if I went to an orthopedic person, who I have one who happens to be very close
They
to
would
me.
have operated.
No, I would have first gone out for physical therapy after they read the MRI, right? Then if that didn't work, I would have probably had to get a shot. Okay? If that
Cortisone?
didn't work, I would have had medication. So I said to myself, gee, why I forget the orthopedic, forget the therapy, I just saw him. And guess what? If you don't believe me, talk to my wife. I'll give you her number because she's probably still sleeping. It works, folks. I'm trying to educate you before you go under the knife. God bless you. I want you to know that there is somebody there that will prevent you from going under the knife. And the number to see Dr. Pannozzo is 561-389-5800.
381.
Oh, 381. Gee whiz, because I never call you. 381-5800. That's 561-381-5800. And you know what? I put a challenge out to everybody who's listening, orthopedic surgeons, everybody, that if he can't cure you with the pain you came in with, you and your husband or your husband and you pick the restaurant you want to go to, and it's on me and Freddie. Nobody kidding.
I got no problem. I'll take a piece of that.
Because it's a bet I can't lose.
It's a bet you can lose.
Pick a
And
good
they start.
steakhouse.
And I'm gonna tell you something, Les. I was a catcher for 18 years.
Yeah, you were involved in
18
sports
years.
like this.
And I have flat feet. And when I met Dr. Pannozzo, he put a thing to give me an arch in my foot.
And that's his own design.
And that's his own design.
right.
Which, we've never even talked about that. I don't even know where he is with that right now. But the inflammation that I have that he took care of came from the arch of my foot. The back of my leg is no problem. Of course, there's going to be inflammation in the front because there's still more work that we have to do. And the injury, Doc, is my hip. It's my left hip. Because all of a sudden, I have these pains in my left hip that goes down my leg and lands at the bottom of my foot. My knee hurts on the outside. And I'm listening to all the things that he says. He puts his finger right where it is.
He did with me and does it with everybody.
And until you go into that office and you see it for your own 2 eyes, I bet you're going to tell 10 people, forget that, come here, take a look.
I always say to people, I don't care who you are, whenever you go in for surgery, no matter what kind of surgery it is, you're in the hands of an anesthesiologist, you're in the hands of someone that's going to cut into your body.
Right. This is what I get all the time. Somebody called me up and we treated her for scoliosis. Well, she didn't like to pay the fee every time.
She was.
So she went somewhere else. All of a sudden, she wants me to tell the other guy what to do.
Oh, good. That's nice.
I mean, you can't treat a physician like that.
No.
If you want someone to take care of you, go to them. If you want somebody else to do it, then go to them.
How many years you been doing this?
Well, 52.
Okay, so why would you give the magic pill to somebody else?
But I want the doctor to call me, not her.
That's
not
right.
the patient.
That's right. If you question, have
Yeah.
your doctor call Dr. Pannozzo. There you go,
the
Doc.
doctor call
There
me.
you go.
First
I
of
like
all,
that angle.
They're not going to have the equipment necessary.
That's right.
Say that again.
They're
You want
not
the
gonna
doctor
have
to call you.
technique. So I got to start. You buy this equipment. Now here's a technique. I'm not in that
No.
business of training people. I mean, if you want to get treated, we're going to treat it.
That's right.
But don't go somewhere else and expect me to train everybody.
Okay, folks, it's come time to
Give Dr. Pannozzo's numbers to doctors and patients, and everybody can call.
all of the doctors out there, all of you surgeons out there, all you chiropractors out there who'd like to speak to Dr. Pannozzo and find out how you could not only help your patient to live a good life, but question him and look at everything. First of all, call him at 561-381-5800. 561-381-5800. And again, could you call after we get off the road at around 12:30? Because I don't want I can't lose this guy. Thank you so much for joining us. We will be here again. And
Thanks for the calls, those of you who called.
And again, the people that are writing to us, I swear to you, I will get to these calls one of these days. Thank you, Colleen. Thank you, Freddie. Thank you, Linda, and always my friend. Thank you for all the information you give every time you're here.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
News, traffic, weather, every 10 minutes.